just gets me in the right mood. When I came out, HIV was doing its thing. It was all on the news. You heard a lot of messages about that this was some retribution from God, that there was some doom waiting for you, you know. And I just remember like the conversations then were not the healthiest. I think that there was a lot of stigma. I caught an STD early in my life. It was something that I was able to resolve, you know, quickly. When I had that experience, I remember this doctor's look on his face. He looked at me like I was some vile creature, you know? And like that, what I just did, like laughing at that, allows me to kind of go back and just get the services that I need. But it's not sufficient for us to say to our community, well, you just have to kind of get over and go back and go get the services you need, get the things that you need. The clinics, the providers must be trained in a way to understand how to keep things comfortable and culturally appropriate. The last thing you need is to feel judged by the provider or any of their staff. There is a distrust because we're not being treated like a full human. There is judgment happening. So tell me more about, you know, some of the barriers that you've witnessed to healthcare.
Housing and transportation. If they don't have transportation, then how are they going to get back and forth from the pharmacy?
Do I take off my job to go get housing resources or just food access or a bus pass?
Navigating the other side is crazy, it's scary, it's a lot, it's draining. From social services, from just like getting medical attention when you're uninsured, it's a lot. It is a layered process that takes time, and we haven't even got into all the other elements of food access, transportation access, etc. All those kind of like hierarchy of needs elements. So it's all these barriers that just continue to pile on.
You feel more stigmatized because not only are you missing appointments, you're missing your medication, so you kind of feel beat by the system almost.
HPTN 096 is a study that is testing a strategy that looks at the various ways that make it difficult for Black men to get access to HIV prevention and treatment. This study has 4 components. All 4 strategies together, we think, has a better chance at addressing the barriers that get in the way of Black men getting access to the prevention and treatment that we need.
We cannot teach people how to love, but what we can do is provide practical examples, provide data, and that's what I love about this study, is giving us the tools that we need so that we can tell legislators, hey, these are the numbers. Hopefully they'll say, hey, this is what we need to do, showing that we can eradicate this. And we gotta start being a voice and showing people like this is important, because until we start doing it, nothing's gonna happen.
Looking at the policies that are local policies, local funding, and looking at and petitioning and saying, hey, y'all, we need to put a little bit more funds towards your county's health and human services.
Peer support is more than supporting someone who's positive.
We gotta make sure that we're treating the whole person.
Having those peer supports really, I feel like for the youth, it does a lot.
We have to continue educating and training around internalized stigma. When you unpack that internalized stigma, you start realizing, wow, I'm exuding this into my clients. And this is not what I'm supposed to do. It's the antithesis of what I'm doing. Learning around like how to really treat people with like genuine care. That's something that's starting in pockets throughout the South, but not enough.
On the social media aspect, I think it's paramount for us to really focus in on like making sure that the people power this and push this narrative forward that we're trying to create for 096.
Showing folks positive images and promoting it in the way that we should and educating it in the way that we should.
You are human. You don't have to be like everyone else to fit in. Be yourself.
Launching the study and getting to this point is already very successful. There are more people thinking about prevention and treatment, and more people who are willing to get on board to help end this HIV epidemic.
And when I look back and I see friends that have tested positive, friends that have passed away, and that was really my inspiration in getting in this work, because there should be no one passing away from HIV in this day and age with the resources and tools that we have.
096 is very unique of its kind. This is going to be game-changing.
It's giving people hope, you know, the way that we haven't seen previously. It's like a light at the end of the tunnel.